Hi everyone, welcome back to our channel. And today we're diving into a topic that's still surrounded by stigma, confusion, and silence: menopause. Whether you're going through it yourself, expecting it soon, or supporting someone who is, this video is for you. We're going to break down exactly what menopause is, the common, and not so common, symptoms you might face, and most importantly, how to manage them effectively so you can feel more in control of your body and mind. We'll also cover health risks, treatment options, natural remedies, and what you should be talking to your doctor about. So stay with me, and if you find this helpful, consider subscribing and sharing it with someone who needs this info. What is menopause? Menopause is a natural biological process marking the end of your menstrual cycles and fertility. It's officially diagnosed when you've gone 12 months without a period, and it typically happens between the ages of 45 and 55. Though it can vary widely. There are 3 stages. Perimenopause: this transition phase can begin as early as your late 30s or early 40s. Your periods may become irregular, and you might start to feel symptoms like hot flashes or mood swings. Menopause: this is the point when menstruation completely stops. You'll only know in hindsight, after 12 months without a period. Postmenopause: the stage after menopause. Hormone levels remain low, and some symptoms may continue, though often less intensely. This isn't a disease. It's a natural shift, just like puberty, but society treats it like something to be ashamed of. Let's change that. Symptoms: what to expect. Menopause can bring a wide range of symptoms. Some women breeze through it. Others feel like they're living in a completely different body. Let's go through the most common symptoms and why they happen. Hot flashes: sudden, intense feelings of heat in the upper body. They can last 30 seconds or 10 minutes, and they may occur multiple times a day or night. 2. Night sweats: basically hot flashes during sleep. They can soak your sheets and seriously disrupt your rest. 3. Mood swings. Estrogen helps regulate serotonin, so dips in estrogen can bring irritability, anxiety, or even depression. 4. Insomnia. Trouble falling asleep or waking up frequently. Hormones, anxiety, and night sweats all contribute. 5. Vaginal dryness and low libido. Estrogen keeps vaginal tissue elastic and lubricated. Without it, you might feel dryness, itching, or pain during intercourse. Hormonal changes and body image shifts can reduce sexual desire. 6. Fatigue: not just being tired, but an overwhelming lack of energy. 7. Weight gain, especially around the abdomen. Metabolism slows, muscle mass decreases, and hormonal shifts affect fat storage. If you're going through any of this, you're not going crazy. It's real, it's common, and it's manageable. Let's talk emotional health, because this part often gets overlooked. Menopause isn't just about physical changes. Many women report feeling out of control, anxious, even grief-stricken. You might feel like you've lost your spark or identity. This can be tied to changing hormones, but also to life stages, empty nesting, career transitions, aging parents. It all compounds. And let's not forget the silence around menopause. Many women feel alone because it's rarely discussed, even among friends. But you're not alone. Millions of women are going through the same thing. And there's help, from therapy and support groups to medical treatment. As estrogen levels drop, you also become more vulnerable to certain health conditions. Osteoporosis: estrogen helps maintain bone density. After menopause, bones become more porous, increasing fracture risk. Heart disease: estrogen protects your heart and blood vessels. Postmenopause: your risk for heart attack and stroke increases. Urinary incontinence: changes in pelvic muscles and vaginal tissue can lead to leaks or urgency. Changes in cholesterol and insulin resistance, which can increase the risk of diabetes and high blood pressure. This is why regular checkups and lifestyle changes are so important during and after menopause. Now, let's talk about solutions. What can you do to feel better? Lifestyle changes. Diet: eat whole foods, especially those rich in calcium, like leafy greens, dairy, and nuts, and vitamin D, sunlight or supplements. Add phytoestrogens from foods like soy, flaxseed, and lentils. Exercise: aim for at least 30 minutes of movement most days. Walking, weight training, yoga, all help with mood, bone density, and weight. Sleep. Stick to a sleep schedule, avoid screens before bed, and consider cooling your bedroom for night sweats. Stress management, meditation, deep breathing, journaling, and talking with friends all make a difference. Avoid triggers. Alcohol, caffeine, and spicy foods can worsen hot flashes for some. If lifestyle alone isn't enough, there are medical options to consider. Hormone replacement therapy, HRT, the most effective treatment for many symptoms. It replaces lost estrogen. Vaginal estrogen creams or rings, targeted relief for dryness and discomfort, with minimal systemic absorption. Many women explore natural treatments like black cohosh, evening primrose oil, or acupuncture. Results vary, and not all supplements are backed by science, so be cautious and always check for interactions. Also, support matters. Join online forums, local support groups, or even talk therapy. You don't have to figure this out alone. Menopause is a turning point, not an ending. It's a time to pause, recalibrate, and reclaim your well-being. Your body is changing, but you are still you, strong, wise, and capable. If this video helped, please give it a like, share it with someone you care about, and hit subscribe for more empowering content. Let's keep the conversation going. Drop your experience or questions in the comments below.